Hello, we are Group 2 and today our presentation topic is BRCA1 and BRCA2 mutation in human breast cancer. So let's talk about what is human breast cancer. Breast cancer is a very common malignant cancer in a human woman, in the female. As you can see in the epidemiology, in 2014 in the United States, we had around 235,000 of female developed of the breast cancer and around 3,000 to 4,000 people was died. And in Hong Kong, it's around 40,000 and around 600 was died. So you can see that it's very common all around the world of the women. And about the breast cancer, we can talk about the signs and symptoms. The first symptoms, which is mean that the symptoms you will find on your body at the first time when you feel something sick is the breast lump, which means that you are feeling something thickness, something thick or a lump, a piece of fat around your breast and your armpit. And also the nipple discharge with the blood, and also the masseter, the breast pain and tenderness. Also the dyspnea, which means you are hard to breathe. Or maybe we can look more in a microscope way, which is the stellar change. As you can see, the hyperplasia, which means that when you under the microscope, you see the cell growth in an abnormal way, you may have a breast cancer, which is the malignant but not the benign. And also the tissue change. Maybe you can find the cell which is surrounding of your pectoralis major muscles.
For the causes, there are two causes that causing the breast cancer. The first one is hereditary mutated gene, and the second is gene mutation. So first of all, let's go to the hereditary mutated gene. It acquiring mutated BRCA1 and BRCA2 gene from family. Therefore, it cannot produce tumor suppressor protein, and the damaged DNA is impossible to repair. Therefore, the stability of the cell cannot be maintained. So for the gene mutation in BRCA1 and BRCA2, they are located in chromosome 17 and 13 respectively, and the function is act as a tumor suppressor gene. It encodes the protein that repair the damaged DNA with high fidelity. So how the mutation leads to breast cancer? For the mutated BRCA1 gene, the formation, it will cause the formation of high grade 3 subtype with high mitotic rate and triple negative breast carcinomas. That means the cancer is not supported by hormone estrogen, progesterone, and the presence of HER2 receptor. That is what we call triple negative. And for the mutated BRCA2 gene, it will result in ER and PR positive, and also high gene 2 or 3 carcinoma.
So for the pathologic mechanism, I will briefly introduce now, and then if we have normal breast cells, and then it will undergo DNA damage, for example, damaged by the ionizing radiation, and then the gene inside the cell will be damaged, for example, the BRCA1 and BRCA2 gene. And then this is the first cause, and the second cause will be the heredity, the mutated BRCA1 and BRCA2 gene from the parents. And these two reasons will lead to the loss of the genomic stability, which occurs when both copies of the DNA repair protein are lost. And therefore, if we do not have enough DNA repair protein and we are failed to repair the damaged BRCA1 and BRCA2 gene.
So there are three consequence reasons by fail to repair damaged BRCA1 and BRCA2 genes. The first consequence is about the mutation in proto-oncogenes, and it becomes oncogenes enzyme to stimulate the cell growth and then even abnormal divisions of cells. And then the second consequence is about the mutations in tumor suppressor genes, in which the cell loses the sensitivity to the inhibitory signals and leads to the uncontrollably cell growth. Which is the last consequence is the decrease of apoptosis, the DNA damaged cells, which then the cells is resist to death, and then with free of such consequences, it will lead to the increased number of DNA damaged cells. And then also in women, the estrogen hormone increase mutated breast cell divisions, which then will lead to unregulated DNA damaged cells proliferation. Thus, the cancer cells will then undergo angiogenesis and then they will escape from the immunity, thus it will cause some clonal expansion. What is clonal expansion is the process that cancer cells increase in number and create additional mutations.
So after the clonal expansion process and tumor developed, and then after several stages, and it may become the malignant breast cancer, and it may undergo invasion and also metastasis to other nearby tissue, and then for example, the bone tissue. The bone tissue is one of the preferred places where the malignant breast cancer will grow.
To prevent breast cancer, there are several ways to do that. First of all, to maintain a healthy lifestyle by having a balanced diet and avoid alcohol is an efficient way to maintain a healthy lifestyle. Also, doing examination by self or go to the clinic can also achieve that. And by screening, having mammography can detect the presence of breast cancer tumor, and also by surgery, carrying out mastectomy can by removing the whole breast can prevent breast cancer that's caused by hereditary. To treat breast cancer, the goal is to eliminate or inhibit the growth of cancer cells. For the cancer that haven't spread to the rest of the body, we can carry out a surgery or radiation therapy to treat breast cancer. By surgery, we can remove the whole breast or the part of it to remove the breast cancer tumor. And by radiation therapy, we can kill cancer cells by using radiation. And on the other side, to treat breast cancer that have spread to the other parts of the body, using chemotherapy or hormonal therapy is the effective method to do so. Chemotherapy is to use cytotoxic drugs to kill or inhibit the growth of cancer cells. And targeted therapy is one of the chemotherapy which is with fewer side effects. So for hormonal therapy, it is better in preventing recurrence and inhibit the growth of the cancer cells. It has relatively long treatment period that is counted in years, and from current recent research, hormonal therapy is not applicable to triple-negative carcinoma, as it is affects the hormone secreted. So for premenopause women, using anti-estrogen drugs such as tamoxifen, it can stop the growth of cancer cells by attaching to estrogen receptors to inhibit the growth of cancer cells. And for the postmenopause women, using aromatase inhibitors can prevent conversion of androgen to estrogen, and in order to inhibit the growth of the breast cancer cells. There are several side effects that caused by the several treatment methods. First, by surgery, the appearance will be affected because of the removal of the breast. And for the chemotherapy, since the cytotoxic drugs may attack the normal cells at the same time, so the patients may experience hair loss and have an increased risk of infection due to decreased leukocytes number. And for radiation therapy, patients may experience erythema and desquamation. And for the hormonal therapy, for the patients that have anti-estrogen, the patient may experience embolism, stroke, and thrombosis. And for the patients that have aromatase inhibitors, they may experience hot flashes and night sweats.